TDR Regional Training Center in Implementation Research in the Western Pacific region. It's one of the TDR Regional Training Centers that is relatively new, around three years. So I'm going to talk about, in a very practical way, what is the offering in terms of training in implementation research by the Western Pacific region. So we have been invested in training, particularly online training, and also face-to-face training. So the United Nations University, the University of Himalaya, and into the ISRR, that is the Institute for Health Systems Research, are part of this consortium, and we have been joining effort to design and deliver and implement these training courses. So I'm only going to talk those courses that are available online and that are open for all of you if you want to enroll. So our main course is a massive online course in implementation research that is quite consuming in terms of time, and it takes around 6 weeks to complete, not only with online lectures, but there's also a platform for discussion that is moderated by us, I would call it the researchers, experts at the Regional Training Center. So far we had 2 annual sessions, so we are going to have a third one this year, starting in November. And these courses are primarily for people who are policymakers, academics, researchers, practitioners, many people coming from CSOs, NGOs in the Western Pacific region. So far we had over 2,000 applicants. Up to last year, that was our last session, and 80% are from low and middle income countries, 60% are women, and 33% are from governments and 39% from academia. So we have a very good balance in terms of academics and non-academics. So I will tell you in a minute how to access these online courses, but I just want to show you that based on the research proposals that participants need to submit at the end of the course to have a certificate that are signed by WHO TDR, we just compile all these research proposals that are called letters of intent. So the participants, they need to think of an implementation research problem and then write a proposal or how they would implement it, the research in their country. So we developed a website. I'm just going to show you very quickly because it's something that we just finalized it. Give me just a second. So this is a website that is online, public, irmooc.org. So if you click in a country, we can see what are the implementation research. For example, Indonesia. So we can see how many implementation research proposals were submitted by MOOC participants from this country, and then we can have the profile of these proposals. So, for example, Indonesia is only one. So with this website, we can look at trends in implementation research to see what are the countries that have been chosen majority for implementation research. And give me just a second because I don't think I'm online. Yes, sorry, I think there are some challenges with internet. I can show you in the slide. Okay, so we can see this dashboard that will show us the countries and the number of implementation research in the countries, and then infectious diseases, the implementation strategies that were the focus of the letters of intent, the implementation research outcomes, the research methods, and the types of data. So we are planning to continue building this website. It's a crowdsourcing platform. For every person who participates in the implementation research course, they can come here at the website and say submit the research proposal, and we have a text mining script that will scan the proposal and get the information that we need and display it in the website. Okay, so other course that we developed at the Regional Training Center is an online course on incorporating intersectional gender perspective in implementation research. So this course is shorter, it is only 3 weeks, around 5 sessions, 1 session per week, and in terms of the study time is only 2.5 hours a week. So it's directed to academics, to policymakers, to CSOs. There are many examples. We try to make it very practical and to have interviews from case studies from Uganda, from Nepal, several types or several infectious diseases, so we don't focus only in 1 or 2. And this course is also available twice a year. So the last session was in June, so we plan to have it another session before the end of this year. And this one is global, not only for Western Pacific region. So other course that we also developed at the Regional Training Center is a short course in implementation research. Based on the main implementation research course that is around 6 weeks, one of the feedback that you receive is that it's too time consuming for people, for health managers and implementers. The language was a bit too academic with jargon, particularly related to research terms. And also the case studies, they were mainly from the Africa region, so people in the Western Pacific region, they wouldn't relate to the case studies. So we developed a very short MOOC, that we call it the mini MOOC, that is only 2 hours, so we can take it in 1 day. There's 5 sessions that are 5 different lectures, and the lectures are from the University of Malaya. We have the International Institute for Global Health and the Institute for Health Systems Research, different types of academics, some junior researchers talking about implementation research with a case study from Malaysia, from dengue prevention, from a behavioral aspect of the dengue prevention in one region in south of Malaysia. We went to a community in Johor Bahru, and we interview members of the community to ask them what was the experience on implementing the intervention. We hear from local leaders, we talk with academics who are the principal investigators of that research, with the public health officers, and we put this case study together and to illustrate some of the main concepts related to implementation research. So this mini MOOC is going to be available from September, so we are actually recruiting beta testers, people who can enroll in this course and give us some feedback for improvement. So if you're interested, just drop me an email and I can register you for beta testers. So how can you access all these different MOOCs? So if you can go to the website, I will try to go there again. Okay. Yes, so if you go to the website tdrmooc.org, you can sign in, anyone can sign in, and you can you have a selection of the courses that you are enrolled. So some of them are active, others you need to wait for the next session. So you can see that there are not only the courses from our Regional Training Center in Western Pacific region, but also other courses. And finally, if you're interested in knowing the schedule of these courses, you can go to the main TDR website. And the schedule is published and updated every month. So the next one, if you're interested to take the main implementation research MOOC, it will be the 4th of November. And there will be a leaflet where there will be a link for interested participants. And yes, so this is the offer that we have. There are lessons learned that we learn throughout the design, the conceptualization, the delivery of these books. And one of the lessons is that we need to localize the content and the examples. So this is a feedback that we have been receiving, is that if you are offering a training for a certain region, we need to have examples from that region and experts from that region. And that's the main rationale from us to do the case study for dengue. The other type of feedback that you receive has to do with the language. So the language needs to be accessible to different audiences. That may be challenging and to do it. So I think if you know our target audience, and if you have experts who are part of this audience reviewing the content of the book, we know that the knowledge transfer will be more effective. And that's also one of the reasons that we do a mini book for health implementers, because the main book, it will be mainly for, I would say mainly for researchers. And yes, so if you're interested in knowing more or be part of the beta testers or enroll in these courses, feel free to drop me an email. Thank you very much.
Thank you, Claudia. We move on to the second speaker. Second speaker is my colleague, my friend, Professor Dr. Rafdzah Ahmad Zaki. I don't have to repeat her credential again because she presented 3 times already. So we'll be repeating her for 3 times. But please, Prof. Rafdzah.
Thank you, Professor. I don't have many to share, but just to highlight, because Dr. Claudia already mentioned about what are the available training that we have under the WHO TDR. So here I just want to highlight another, I would say, important resources, especially to the researcher, if you want to practice implementation research. So this is called Implementation Research Toolkit. This is actually, they have come up with the latest edition with online version, because previously it's all in a PDF form for you download the toolkit. Okay, so this is actually originally developed by TDR in collaboration with USA. Okay, but the latest version there's received a support from the Access and Delivery Partnership through the United Nations Development Program. So perhaps later I can show the website. So I will share the link. So, but for the latest version of the toolkit, you can directly experience the learning online. There are a few interactive buttons that you can click with case studies and so many others. Yeah? So what has changed since the previous toolkit? So this was first launched in 2014, but since then they have improved the content of the module, which much better focus, and they include a new modules in the toolkit, which include understanding the IR, integrating IR into the health system, IR with the communication, and recently they add in IR in One Health approach, because if you look at the WHO TDR latest strategies, what they want now, they want to apply the One Health approach when they are tackling the infectious disease of poverty. So the 4 key things like epidemic and outbreak management, control of elimination of disease of poverty, issue on climate change and impact on health, and also the resistance to treatment, all of these 4 areas, they want to apply the One Health approach. So basically they want to bring the One Health into the implementation research. And like I mentioned, this new version, it's a self-learning format, unlike the previous version, just like a PDF version you read through like a workbook. But this one is, they feel that it's a bit more interactive, so you can access directly online. And so that they can access the toolkit anytime. And this also are self-contained. You can use state alone anytime or whenever you want to get the resources. So I think we will just go to this quickly. Basically, this to help us to apply a structured process of identify what are the problem in our research. They teach us how to identify and engage appropriate stakeholder, formulate appropriate research question, how to determine appropriate study design, how to explore potential issue, and how to communicate throughout the process. So basically, with this tool, you can identify barriers to implementation and formulate the research question, make your case for funding, because they have a guide on how to write a proposal and so on, and set up your study design with appropriate methodologies, plan your budget, how to collect, analyze, disseminate information, and monitor and evaluate your research project. So these are the content. They have 9 modules, but the last module is actually still under development. So if you access this system now, you can only explore module 1 to module 8. Yeah. So the first one is on introduction to implementation research. So it's a basic concept, mainly what probably have learned the concept of IS. But here, because they're really more focused on the research, of conduct of the research. And then the next module is again more concept on IR, why the need of IR, the outcome, characteristic. They have a section on community engagement and ethical challenges. So if you go through to the section, you can see there's a case studies on this example. But like Dr. Claudia mentioned, most of the case studies are actually based on the African region, because when first they developed the content, the grant funded India region. So that's why now we are trying to start to develop the content that is more relevant to our region. Module 3 is on developing and implementation research proposals. So here they will outline who are the team, research that needed, and then what are the structure of proposal that needed for IR, the research design, project plan, funding, how you can start to look for funding for a project. There's a lot, but I would say that it's not maybe in really detail, but they cover the important aspect that you know. So probably so that you don't miss. Yeah? But if you want to know detail, perhaps you can attend much more specific training. And then they have also section on research method and data management. They talk about mixed method, research tools, sampling, data collection, but of course it's not really in depth, but they highlight what are the important, like research method, sampling that you need to aware of, what kind of information that you need for data collection, management and analysis in general for IR study. Okay, and then they cover project planning, project monitoring, developing and logic model, monitoring question, data use, project execution, ethical issues, and good practice in IR. So there's quite a lot of aspects that need to be covered in IR. Then they include on communication and advocacy in module 6. They have productive dialogue, knowledge translation, research evidence, policy advocacy, how to present and visualize your data, and so on. And module 7 is on building your team, how to look for funding, what kind of information needed using the WHO health system framework, and they touch on the principle of sustainability. And finally, in module 8, they talk about developing implementation research project with an intersectional gender lens. This is a new additional module also, so you can look on how that integrating this intersectional gender lens in implementation research with a case example and how they execute the project and good practice that involve gender perspective. And we're looking forward to the new chapter module 9 on the One Health approach. So this is the link to the web page. To show you. This is the web page, so you can explore according to that. This is the different module, the 9 module that they covered under this toolkit. So this is the outline here. You can click and then here you can check on detailed content of each module. So I hope those who are interested in conducting the research, these additional tools that you can use to guide you when you want to conduct your research, specifically implementation research. I think that's all.
Okay, thank you very much, Dr. Claudia and also Prof. Rafdzah. And I would like to continue to share with you what we are doing in UM. Basically, we actually set up a center, the center that learning center that Prof. Rampal just mentioned just now. It is currently located in UM. All right. So the center is actually an area where we can develop what was mentioned just now by Claudia, MOOC courses and also other kind of activities that you can actually run within the center. So I will share with you what we have in the center. And actually the information is available from our website. Right. So the center was launched on the 3rd of October 2023, last year. Alright, so it's located within the UC Malaya of the Faculty of Medicine campus. So that the center actually is used for online hybrid teaching, content module development, like micro-credentialing, MOOC courses, video and audio recording, interview session, live streaming, videography and studio instruction, communication graphic, and also for podcasting. So we have a center located within University Malaya Center. So within Faculty of Medicine UM to actually be able to look at it. So the center, sorry, let me go back. Alright, so this is how the center basically all begins with, and we have a lot of things being put in the center to actually develop the center and change it from a room, and we install a lot of equipment for us to be able to do all the activities that I mentioned just now, which is all these things, online hybrid teaching, content module development, video and audio recording, interview session, live streaming, videography, studio, instruction, communication, and graphic design and podcasting. So these are some pictures from the center. During the launch. Alright, so we have a different, so it's a room, but beside the room also we have a area where we can do all the other editing and also activities. Alright, so this is about the center. Now we will continue with the second part of our discussion today, which is going to be on discussing about the MOOC and also courses and also the toolkits. I would like to open the floor to any question that any one of you have on that MOOC courses and toolkit. If not, then I will start by asking Claudia. For the MOOC courses itself, you show that there's different kind of courses, all right? How can people who are interested actually want to join those courses? And you mentioned that there's some with commitment, that means long, they've got to use time, but what are the criteria? Is there any prerequisite for the individual to actually join those courses?
Professor Vidya for the question, because I forgot to mention that. So the different courses have different prerequisites. So I would say that anyone can join. If you go to the TDR, the IR MOOC website, you just need to sign up and then you see the courses available. But for example, the main implementation research course is open to people who live in a certain region. So Western Pacific region, we normally use Asian countries. People who live or who are from Asian countries, we will have priority. But for example, the gender perspective in implementation research, there's a prerequisite to have done this implementation research MOOC. So only people who do the main MOOC then can do the gender. And that is open to anyone in any country. The mini MOOC for implementers is also only for the Western Pacific region. So if you're interested, in the TDR website you have the schedule of the different MOOCs, and there will always be a flyer just one or some weeks before the MOOC starts, and the flyer indicates the prerequisites and the target audience. Thank you.
All right, thank you very much. It's interesting. All right.
Prof, sorry, I just want to add. I know you mentioned that there are a few MOOC that is actually only available for WPR region, but actually when we run the course, we do have requests from those outside WPR region. So we do still accept them, so they can still attend, but they have to request our admin. But in the end, for our reporting to TDR, we only report for those participants from WPR, because we understand knowledge is for everybody. And you cannot block knowledge by a boundary. So we do open to others, but yes, that is, we run this for our region. We open especially for our region, but when other participants from outside they want to join, we still accept them, but we do report to TDR on that. Yeah.
Okay, before I continue, maybe I can ask you all, any one of you actually have attended any of those MOOC? Maybe put up your hand. Okay, Prof. Moy. Besides Prof. Moy, anyone else?
I PhD, I hope everyone.
All of you? Oh, you are here. Oh, you came. Alright. You still got one more friend, alright? It's okay, no worries. Alright. So all your colleagues, besides that? Alright. So none of you have done it. Maybe you all can actually go back and see whether any one of you have heard of the toolkit before? No, alright, okay. Let us continue with the discussion, maybe, alright. So you say anybody can attend from the region, Western Pacific region. That's the only prerequisite. Is that like, do they need to have experience? What is the experience that they need before they actually join?
I would say that they don't need any experience, but for the main MOOC, I think they need to have some background on research. Of course, if you have experience, some experience in terms of public health implementation, that will help for the discussion, will make it richer, because there's a platform. The MOOC is not only online lectures, so after the lectures we have some prompts for discussion, and then we moderate the discussion. And some of the questions is, have you faced a challenge similar to the one in the case study? Can you give us more information of the project that you're working on? So that will help to to foster a discussion and people can learn with one another. It's not only unidirectional.
So anyone with health science background can actually join. Let's say I'm a fresh grad, just finished my medical school, and I'm sitting down, got nothing to do. What is your advice? Do I join or don't join?
Yes, I think we encourage everyone to join. Maybe you cannot contribute as much from the discussion, but we'll learn from others with more experience.
All right. And what actually do they get out of it, especially from a fresh grad perspective?
Okay, before I answer that, just to add in, yeah, of course, having a background in public health will be helpful. But again, anyone who have interest in the area, they can join. But to gain the certificate, there are certain, because at the end of each section, there will be a quiz. So you have to answer the quiz. So you have to score a certain mark for you to eligible to get the certificate in the end. And then for the big MOOC that we run every year, that's Dr. Claudia mentioned, the one that we run at the end of the year annually. At the end of the course, you have to come up with a research proposal. So means that you need to have some sort of background for you to come up with the proposal. So your question about, sorry, I forgot your second question.
My second question is about, I forgot the second question. What was the question? Why? Yes, boy? Yes, please, can you please ask question?
Hi, I'm Moy here from UM. I'm not asking question, I'm just making comment.
Okay.
Actually, it's not easy to do the quiz. It's not easy. Because although I have a background, right, the study design okay, but there are scenarios for you to go through in PowerPoint presentation, and then you will be tested about whether you really went through the slides. So I tried to answer without going through the slides, but I don't know the scenario, so I could not answer. I have to go back and watch and read the PowerPoint. Yeah, it's not easy. I think for undergraduate, they may not be able to pass, to get the certificate. So if you don't achieve 70 marks, is it 70 in total? Then only you can get the cert. If not, all you have to wasted. I mean, you learn, but you don't get a cert. Yeah, that is my experience. Also because I did last minute, so there's a timeline. So I was stressed in answering few quizzes in one night.
Okay.
So that was my comment.
The take-home message is don't do it last minute.
Do last minute.
That's what I tell all my students. Don't do last minute.
Yeah.
Secondly, make sure you listen to the lecture first. The second take-home message. All right. This is from my professor.
Yeah.
All right.
Professor doing exactly what.
Yeah, the professor doing exactly what not supposed to do. All right.
Because I wanted the cert, you see, so I was busy to go through the slides. So towards the end, before the deadline, I did it at night.
So it means that the course is actually very in depth, and there's a lot of things to learn. I think that makes it valuable in the context.
Yeah, thank you. I think it's very good
Yes,
experience.
alright.
Yeah.
Thank
Okay.
you.
Well planned and well planned.
Rampal, want to share? Okay, let Rampal share.
Thank you very much for the discussion. Actually, I'm not sharing. I'd like to ask a question.
Yes, please ask.
So the TDR concept is based on tropical disease research. In Malaysia, in the region, we also have a non-communicable disease problem. But with the knowledge and skills that one learns from this, is it transferable to other diseases, toward the prevention and control of the other diseases?
Yes, that is one of the questions I want to ask also. But since Rampal asked it, we will start with the person holding the mic, and then we go back to Claudia.
Yes, I would say the answer yes. You learn the concept, you can apply the concept in any other diseases. But of course, the case example, the scenario that you see in the MOOC will be based on the tropical diseases, but the concept can be applied in any disease.
to add that it was a concern from us at IGH, because when we have projects, partners in different countries or globally, we ask them to do the implementation research course. And recently we had a project on maternal and child health in Africa, and there was a question that they asked us. So we understand the concepts, but how can we apply this to our project? So we had to do a face-to-face training to how to translate the concepts from infectious diseases to maternal.
Yeah, I mean, we are getting answer from two experts here that says can be transferable. But the problem is a lot of people with learning are not, their knowledge are limited, their skill set are limited, and some of them cannot go beyond the transferable part of it. They cannot transfer. What is your thoughts on that? How can we improve it? How can we use it?
Yes, learning is a process. So I think attending one book is not enough for you to do everything. So you have to attend a few other training. And even myself in boot camp, this is my 4th boot camp. I learned so many new things in this boot camp also. So I think if you feel that you really want to go to that area, you want to explore, after attending one training, you think that it's not enough, you want more, I think please do. You can repeat the course again, you can attend the similar training from other organizations that can help to improve your knowledge.
Is there any other recommendation that using anywhere else people use this concept of IR for non-infectious disease, for maternal child health concept? Any examples so that people learn by example? Is there any example from other area? Have you gone through?
Yeah, I think for NCDs and obesity prevention, there are several examples of using implementation research. And I think just because we present these different moods and these infectious diseases of poverty, maybe give this idea that can be applied only in these areas. But I think even TDR, they are trying to challenge this idea and have case studies from different diseases, from different regions of the world. It's a strategy they started last year. If you go to the website, you see that you can do the implementation research course, and then of course you need to watch the examples that they are in the course, but then you have extra models where you can look at case studies in different regions and infections.
Okay. The question, any question? You are here, I'm keeping you here until what time?
Done with it.
Finish. Wrapping up already, okay. Last question before I wrap up. Alright, for the case study, alright. Can anyone contribute to the case study? Let's say I'm working in the Ministry of Health, in a district in Sarawak. I got some ideas. How can I contact you to say I want to start and write a case so that I can contribute as a case study, because my case is very interesting that I want to share with everybody. So what's your how can we do it?
In terms of translating the context of the module to our WPR region, I think we are in the progress of doing that. So I think if we are looking for, especially the case example in the local region.
Yes.
If you feel that and you want to highlight your study that you think is related to our, you can contact any of us. We can fit in of any of module that we are developing, because it is in the process. We are still improving the content. So please let us know.
Okay, is there any services that you can offer to actually help us to write the case, to develop the case? Because we have, most of the time people are not clear. They see a patient, they see something happen and they've done it, and they just want to share the case. So can our facilities actually do that?
For recording, yes, but for the development of script, usually what they do, they will get the experts of the concept, go through the case study, so they will work together with the case and how to match that. Is actually follow the framework or outline of the IR. Then with the script, they are reviewer. Then finally, in the end, then if we want to record, then probably get.
Okay, so we need to get a case and we need to write a script. And then we can submit it. Then we would send to the expert to review it. Once it's accepted, then we will invite you to come to our center to do the recording. or you can do the recording yourself and send the material to our center, so our center can actually complete the editing.
Absolutely. No, that's exactly the process. And then we have a review by experts, we have a review by the target audience.
Right.
Give us feedback if the content is accessible.
Right.
And then when we have the course that is put together, we have the focus groups and beta testers for
Right.
improvement. So the process takes 1 year at least.
Okay, so make sure that if you're chasing your key performance index this year, plan it next year, plan it this year, so you can get it for next year. Alright. If not, you will be waiting for the year after for your KPI, which is, I mean, some people just chase KPI, so it's okay. Alright. So thank you very much. And thank you for the audience for being so nice and no question. Alright. And I would like